So I ended up talking to Dr. Martinez about my options, and she told me about an ablation. So after taking medication and I still was having bleeding, that was my best option. And the ablation is actually not a harsh surgery procedure. It actually made me go back to work within maybe about a week, and I didn't have any complications after the ablation.
Perfect. So yes, we talked about the ablation. We do two different types. There's the NovaSure ablation, the HTA ablation. There's also a cryoablation. She had the NovaSure ablation, which uses electrocautery to cauterize the lining of the uterus, and that prevents the lining from sloughing. A good percentage of patients actually stop having a cycle after about 3 to 6 months. So it greatly improves the quality of life. She is the perfect patient for it. A patient in the mid-40s, done with having children, but having heavy bleeding, didn't have any large fibroids. She had a polyp, so we did a DNC procedure before that, but she had a normal sized uterus, and so we knew that the ablation would be a good option for her. And in the process of coming in, she met our nurse anesthetist. We gave her some sedation. The procedure itself only takes about 2 minutes. She was in our office recovering for about 30 minutes because we checked to make sure everything's okay before you head home. We got a good cautery on her procedure. We took pictures and showed her. She recovered from her anesthesia. Our procedure involves taking a camera, we look inside the uterus, and then we use the NovaSure ablation, which is actually only takes about 2 minutes. And so years and years and years of heavy vaginal bleeding can be treated and gone in only 2 minutes. So what was your immediate post-op recovery? You say you went back to work in a week, which is pretty typical.
I really didn't have any serious complications. There was a little bit of cramping going on, but with the medication that Dr. Martinez gave me after it completely helped. And my mother also assisted me, and I was okay after 1 week.
And you were up and walking around the next day and doing your typical activities and eating and...
Yes.
Good.
I went back to work. I had an appetite, and I was perfectly fine to do exercising, extended walking, and lifting.
Good. And the great thing is that a lot of patients are back to work in about 48 hours. Now, we always say take some time off to recover because we want you to remain healthy. But most patients see the benefit of the ablation in about 30 to 60 days. Around 90 days is when we say you should know how effective it's going to be for you. So now you are 6 weeks post-op. And have you had any bleeding since the procedure?
No bleeding.
No bleeding.
Discharge.
No bleeding and no discharge. And that's great. That's great. So your quality of life has drastically changed because that's pretty, that's pretty monthly consuming when you're having that amount of bleeding to the point where some women need transfusions, they're failing medical therapy, and they think the only option for them is a hysterectomy, and that is not the case.
Correct.
All right, we have other options for our patients, and we do these procedures and interview our patients so that we can let everyone know. All right. All right. Well, thank you for your time. Do you have anything else to add?
I appreciate the staff as well, as they all took care of me, and I felt like I was in safe hands.
Great, great. And she is here on our Mother's Day Appreciation Day. So after this, she's going to get some food and some drinks and a nice gift. All right.
Thank you.
And she'll continue with us for her GYN care. Thank you so much for taking the time out to do this short little interview.
Thank you.
Thank you for letting us help you blossom.